Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. Now, today's guest, Rena Vanzo, has a very unique business with an amazing story behind it. You've probably seen blood drive vans or maybe mobile dental vans, but have you ever heard of a mammogram bus? In other words, it's called the Boob Bus. But this bus offers genetic testing and ultrasound on board. And yes, that's a first, and it's changing lives across the Intermountain West. So before we jump into the episode, I just have a quick message from our sponsor, Grow Solutions, where health and wellness professionals discover how to double their impact and income without doubling their workload. So whether we're trying to help you eliminate some headaches such as new lead generation, how to get more business into your company or your practice, operational chaos using proven flows, frameworks, and systems. And yes, we help practices and businesses implement AI and agents because they're coming whether you like it or not. So Grow Solutions is not an agency or a vendor. We are your growth partner. So if you've ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can be your growth solution. So drop the word grow below, and either myself or my team will get back to you, or feel free to DM me on any of the platforms. But you're here for a special purpose, and that's to meet Rena. Rena, welcome to the Prime Health Podcast, and please tell us a bit about yourself and what you do.
Hi, Derek. Thanks so much for having me. This is a great podcast and a great setting. I'm just thrilled to be here. But yeah, as you put it, the Boob Bus is really making waves. It's a one-of-a-kind mobile health vehicle that's really specific to breast health. So as you indicated, we do mammograms. That's something that most all women over 40 know about or should know about. If they don't, specialized X-ray to detect breast cancer early. And then we're mixing in some growing components, things people are hearing about more and more, which is genetic testing for certain cancer risks, as well as dense breast ultrasound. So I love driving the bus, and I can't wait to tell you more about it.
I'm excited for it, to learn more about it. Did my little bit of research. Can you tell us, I guess, the background story, Rena? Like, how did it come about? What was the reason that you said, I need to have a bus?
Yeah, it's really not something a little girl grows up dreaming about, right? Becoming a commercial bus driver. But anyway, I really have to say I was kind of at a crossroads. I would say both personally and professionally. I had been in the genetic testing laboratory world for over a decade. We were focused on testing in the pediatric realm for children with seizures, developmental disabilities, and so forth. But working in that environment really gave me a hankering to just continue pursuing business and healthcare and kind of that intersection. And so I went to a business administration program. I got my master's in business administration at the University of Utah. I'm here in the Salt Lake Valley. And while I was there, a few different things happened. I heard from some relatives back in the Midwest that one of my grandmother's nieces was diagnosed with breast cancer, and she had a genetic variant. And that was very much my world as a genetic counselor. Although I was focused on children, throughout the business, you learn a lot about cancer risk variants. So that happened. And I'm in business school, thinking about, ways to deliver products and services in a more convenient way. And I also turned 40 that year and had my very first mammogram. So kind of all of these things were coming together. And, my mammogram experience was probably nothing out of the ordinary. It was nothing bad. It was nothing good. It was just one of these things that you go through. And I found myself thinking about it more and more. And well, gosh, what about this? And what about that relative on my grandma's side? And man, my grandma had breast cancer too. And why wasn't there more conversation about this? And what can these results show? And so I think all of those things together, it just made me think, man, there's got to be a better way to do mammograms and to engage with women in that process. And when I ended up looking, Utah was one of the bottom states in the nation for women getting their mammograms. So it seemed like it would be very purposeful and, really drive public health in a positive way if we were to figure that out.
Yeah. Well, so it started with kind of the personal story behind it, but overall helping a tremendous amount of people, as you said, in Intermountain West. Can you share, Rena, maybe some statistics that help the women that are listening or watching, or even the men related to the women that could be listening or watching with them, some statistics on breast health, if you wish, to try and put a positive spin on it?
Yeah, absolutely. And I'm glad you said that, drawing in the men, half of our population. Men don't have breast cancer screening. They can develop breast cancer. It's much less common than women, but 1 in every 8 women will experience breast cancer in their lives. So, you, Derek, as a man, think about how many women you know and love and care about: partners, spouses, sisters, nieces, daughters, work colleagues, church friends. The list goes on and on and on. So we are all going to be impacted by breast cancer, whether that's directly or indirectly. And it is the second leading cause of death among women in the United States. So not only is it common, it is very deadly. And the best way, the absolute best thing women can do is get it detected early when it's the most treatable. And mammograms are, bar none, the best way to do that. And, it's really unfortunate because as I've gotten into this business, and of course I was looking into those Utah statistics, what is it that's holding women back? Why are women not doing it? Because even on a national standpoint, it's only about 70 to 75% of eligible women are having a mammogram every year. Even though some states are, top of the line, doing good, there's still a long way to go and lots of room for improvement. There are horror stories out there. People tend to not talk about it. I have a very close family and have a wonderful relationship with my mother, my aunts, my grandmother, who was a breast cancer survivor, but nobody told me what to expect. They didn't explain what a mammogram was. So I think it's just one of these things that people don't really talk about. And, that's not serving anyone because of those statistics we went over. So, and that, by the way, is part of the reason why I wanted to give the company and the bus a name that was a little loud and a little hard to ignore. Let's put this issue out on the table and let's talk about it, because we don't want women to skip. We do not want these women to skip those mammograms.
Yeah, I like how you want to bring attention to it, which is very important. Do you think there's any fear behind the women because they really don't want to know the result?
That is a really big one, and I do hear people say that, like, well, I'm afraid. And I'll ask, well, what is it you're afraid of? It only takes a few minutes. It's the pressure isn't as much as it was in previous decades because our equipment has become more sensitive. The process is a little bit different. And they'll say, no, it's not, I'm not excited about the compression, but that's not really what I'm scared of. I'm afraid of the result. And, that may be because they have a family history of breast cancer, or they haven't been for a few years, so they're afraid of what they will find. So it really is. There are certainly some themes, but it's a very individual component for each woman. So I find that, when I'm really able to kind of sit down with them and talk with them, even show them their risk estimate. We do ask questions about a woman's breast and her gynecological history, pregnancy history, all of those things go into an algorithm that helps predict how likely it is for a woman to have breast cancer. I told you 1 in 8 is the average. So that's 12.5%. But depending upon all of these various factors, when a woman started her very first menstrual cycle, when she gave birth to her first child, all of these things kind of go into that algorithm. It's all about kind of hormone exposure in the body. And we have these models, and I can say to a woman, oh my gosh, look, you're actually less likely than the average woman to have breast cancer. So sometimes that can be a relief. Sometimes there is that family history, with a mother, aunt, or grandmother who had breast cancer. And then if you're really talking about it, if we find something today, that's not a death sentence. We want to find something before you physically find symptoms. That's when you have the most options for treatment. Treatment can be the most successful. So I just don't think there's really anywhere in kind of the typical health paradigm right now where people are having these conversations. Women will go to their GP or their annual women's visit, and it's, it generally is a pretty quick rush 4 or 5 minute conversation. And there isn't time to get into these details and this background and these fears. So I think the Boob Bus, part of that whole vision was let's bring this venue to the women. We go to community centers, we go to certain doctors' offices. Even we've been booked for book clubs that groups of friends have together. So let's go where these women are used to being. Maybe they come in with their sister or their daughter or their aunt. And we open up that dialogue and really just normalize the whole process.
Yeah, no, I think that's important. I was going to ask the question, how are people finding out about you? Of course, they see it placard on the Boob Bus as it drives around town. But I think it's very important that, because having minimal knowledge myself of going in and having an examination done, I can't speak to it that way, but I assume that it's a cold place. It's, even though your doctor, it's not always the best environment to be in. How do you think that having the Boob Bus with the big pink bus makes it fun, have it like an open experience? How does that maybe build trust for more people to trust you to have their exams done with the Boob Bus?
That's a really good question. And of course, I'm seeing the positive side of things. I'm seeing the women that hear about us, see us drive by, look us up, maybe get a referral from their doctor or hear about it from a friend, and they're drawn to that idea and they come to us. There probably is some portion of women out there who hear about us and think, oh, that's not for me. That's not at the hospital I've been going to. I'm not used to it. So I'm sure it's a full spectrum, but from what I do see, women really do like, I'll just say the simplicity of it. We may be in a parking lot at the health center or the health department or even a shopping center. And a woman may have, a couple hours, she's out running errands and she thinks, oh my gosh, I have not called to schedule my mammogram. I wonder if I can just pop in for an appointment. And most of the time they can. It takes really 20 minutes from walking in the door to walking out. So it's really a very fast process. And I think that's so much less intimidating than, okay, I've got to drive to the health center. There's going to be a lot of construction. There's a huge parking lot. I'm never sure if I walk into door 3 or door 4. You got to check in here and then you got to walk up the stairs and check in there. So we just have women all the time who say, are you kidding me? I can just walk in, like that's all it takes. So, overwhelmingly it's a positive response. And, we do go above and beyond. Like we have a robe warmer. And so we give women a pink fluffy robe instead of a paper, hospital gown. And so we just try to make these extra touches that really help celebrate the fact that, hey, you're coming in to do this for yourself. That is awesome. We're so proud of you. Don't worry, you haven't been to one in 10 years. You're here now. That's what's important. So, and I do think that word is spreading. We're getting rebooking. 75% of clinics who have booked us once have invited us to come back at least once. So I think the reception is really good and word is getting around.
Yeah, that's wonderful. From the word getting around, I guess a question would be, what has been the reception from the hospital systems of your company? Because of course there's a bit of infringement upon it, but have they been warm and welcoming, or how has that worked out for the Boob Bus in your?
Yeah, and I'm glad you picked up on that because frankly, that was one of my biggest concerns about getting into this business. You know, I am in an area where there are pretty much two predominant health systems, both of whom, by the way, have their own mobile mammogram arm. But they really don't use it the same way that I do, and I can expand on that shortly here. But it was really scary, and you know, for us, you know, we're not affiliated officially with a hospital. We have, you know, those two instruments I mentioned, the 3D screening mammogram and a dense breast ultrasound, but we don't have a radiology on site, which is a requirement to do a diagnostic breast imaging. So about 15% of women who have a screen, you know, their annual mammogram, about 15% of them will have to go back for what's called diagnostic imaging, where there was a concern found. We need to do more detailed pictures, maybe even a different test like a biopsy where we're getting a sample of what's being seen in the breast. And so that second exam can get more detailed. We aren't offering that second step. Ours is more of a general health screen that every woman should have. So really, the way that I've spoken with the hospitals is, hey, we're a partner here for you. You know, we're going to relieve the minds of 85% of the women we see, but there are going to be that 15% that need the follow-up, and they can't come to us. We're going to be sending them to you. And so we've established, I think, really good relationships with all of the imaging centers locally, because there's also a sharing of records that needs to happen. You know, regardless of where a woman has her mammogram, the radiologist is going to want to see, well, what did last year's images look like and the ones before that? Because that's really the key. All women have, their breast tissue is very individual. So the key is, how much has this woman's tissue changed year over year? And that's part of the reason why annual is so important. So if there are any growth changes, we can be on top of that and see that change year over year. So anyway, yes, I have really worked with the hospitals so we can easily share those records back and forth so we can refer patients to them. And as I think many of us listening to this podcast probably know, health insurance in a lot of ways dictates where patients can be seen, who's going to be an in-network provider versus an out-of-network provider. And, you know, we are perfectly happy to, price transparency is actually huge for us. If someone signs up for us and we are out of network with their insurance company, we will refer them, if they would like, to a hospital that takes that insurance plan. Good. So I think it has been collaborative, but I was really worried at first, you know, how would we be embraced and recognized? And with mammography, it is highly regulated. You have to have a medical physicist come evaluate the bus and the equipment. And is it in the range it needs to be? Is it picking up what it needs to? And then there are state and federal agencies that come annually to do similar checks. You know, how are the results getting to the patient? What did they say? How do we ensure this woman gets her follow-up? So anybody who has kind of that stamp of American College of Radiology certification, you have to meet very strict levels of compliance. So it took a while, but I think we are recognized kindly in the industry.
That's good. And I hope you continue to be recognized more kindly, you know, not only just in the Intermountain West, but as you go to stretch out, because I think, again, you are taking great care of a very important patient need in the female population. More people need to know about that. don't know what the plans are in the future. We'll kind of discuss that a little bit later. But I think it's, from what I'm hearing from you, what I read from you, and the social stuff that I saw, it's fantastic. And you get a lot of great responses from the people that have been, involved in it. It almost appears as though, boy, this could be a strong word, it's a party event almost when it happens. Like, people are very happy with the outcome.
Yeah, I think that they are. Sometimes people come in and I think they're always surprised at, it's chilly outside. Oh my gosh, we have heat in here. It's really nice. And I get this warm robe. And oh my gosh, you have water that you give to us, or even Diet Coke if somebody needs a pick me up. Like, and it's just women helping women, is really what it is. And I think people can feel that, they're not a number. They're a woman who has, children and a family, and who's trying to take care of herself. We want to get her in and out. We know that she's got other things going on, but we also want to answer her questions and make sure she knows what to expect when she leaves.
Yeah. Is there a way in which, so like a public service announcement, meaning if you're speaking to all the women that are out there, starting from, like you had said, at 40, they should, like, take us from when a woman turns 40, why they should do this, and, maybe the steps after that.
Yeah. Oh man, that's great. If I got an opportunity to do a PSA, like during the Super Bowl, which, by the way, there was a really good breast cancer ad during the Super Bowl this past year. So I expect another. Okay. But I think I would tell women, 40 is kind of that age, that's when the American College of Radiology has come out and has said, this is when women need to start. Can women get breast cancer earlier than that? Yes, absolutely. So 40 should not be when you're first thinking about breast health. Women should be doing self-exams, and they should be having their doctor do a clinical exam once a year. So this should not actually be a surprise at all. And in fact, some women should start earlier in their 30s if they had, say, a mother or a sister, or perhaps even a grandmother with breast cancer. So it's important to know your own family history, know your own breast health, and not to be afraid, because there are a lot of stories out there about how painful the procedure is, how uncomfortable the procedure is, but equipment has come a long way, and it's not as dreadful as maybe your great grandmother wanted you to believe, or potentially even your mom wanted you to believe. So I think women need to experience it for themselves, and don't be shy about asking questions and getting answers that you want to get.
Okay. So I appreciate you sharing that. I wish you could do a Super Bowl ad for the Boob Bus. I think that'd be very good for the business. Might make you a little too busy. You never know. But with that statement, you are mobile. You are in the Utah area. Like, what's your area of reach? So if people are listening or watching this, where can they be on the lookout for you? And I know it's not just Utah. Can you explain where else you've kind of been, or where you may be going?
Yeah, thank you. It's an exciting question for sure. I mean, right now we are, I generally just say zoned for Utah, because we have a Utah business license. All of our staff and affiliated staff has their Utah medical licenses that is necessary. And so we've been to the northern part of the state in Tremonton, the southern part of the state in St. George, Tooele and Wendover to the west. And then we've also been in the eastern basin as well. So we have covered the whole state. Last year, we got invited to go serve the women on the Native American reservation on one of them in Wyoming. And so we looked at that, we would love to do that. What are the pros? What are the cons? What do we need to get ready in terms of those licenses? So we made similar phone calls as we did here in Utah. Does the doctor have the right state license? Does my mammogram technologist have the right license? Can I get a temporary Wyoming license to go there for a few weeks? So we did all that, and it was just some red tape to go through, nothing hard or challenging, but just had to make sure all of the business operations would be covered there from a liability standpoint, et cetera. And we wanted to make sure that the insurance companies there were also within our network. Can we accept them? who are the payers. So really, I mean, we like to joke, like, I'm willing to go anywhere. It just may take some time and probably some overhead costs to get all of that preparation into place. But we went and served those women in Wyoming. There were about 40 of them that we saw on this past trip, and it was well received. They invited us to come back next year. So a lot of these licenses, particularly the medical licenses, roll on 2-year time frames. So we will be able to go back again and again. And so right now we're exploring opportunities in Idaho as well as Nevada. So kind of starting on a regional level, and it all depends what the business opportunity looks like there. Is there women in need? Are there no other mobiles in that area? Are there a few? One of our favorite things to do is go to business locations, because then, women can come out. It takes 15, 20 minutes. They don't have to take half a day off of work to go get their mammogram. So it's a win-win for the employer and the woman there. So that's kind of how I look at it, is, okay, if we're getting this invitation, can we string together a few days worth of events to make sure we cover our costs for that trip?
Okay. So you hit on a couple of things, Rena, from like a business perspective. So as far as your company and the Boob Bus is concerned, like, what's the focus on your business now? Growing, scaling? Where would you say you're at?
Yeah, really scaling right now. I'm always looking at my single unit economics. Am I covering all of my costs for each mammogram? And it does get a little tricky, because if I'm, within a couple miles of my headquarters, that's a much cheaper trip than if I have to drive 2 or 3 hours. The bus takes diesel fuel just to get there, but it also has to be powered 24 hours. So I have to keep the mammography instrumentation and the ultrasound instrumentation within a certain temperature range. So I have a generator that I run on if I'm not somewhere where I can plug it in. And so the longer we're away from our home base, we're using the gas to drive, but we're also running that generator. And so, the revenue is different. There are certain insurances who pay us here. There are certain insurances who pay us here. So it's kind of a complex algorithm to think, okay, how many miles away and how many hours am I going to be away? How many women am I going to serve? And what do I think that insurance breakdown is? So I'm constantly looking at those kind of single unit economics. And insurance, that's something I've mentioned, but, it's probably worth really driving this point home. Women who are 40 and up should have that annual mammogram covered nearly 100% at in-network facilities. That's the key. The facility has to be working with the insurance. And sometimes insurance companies have really tricky, difficult to understand clauses that may adjust that somewhat. But anyway, that's one of the biggest parts of my job, is working with insurance companies to say, hey, are we being compensated appropriately? Are we being compensated the same relative to the big healthcare center that's a brick and mortar center? So that's really what I'm doing. And then also looking at scaling. We only have one bus. How can we see more women? And we've only been in business since February of 24. So we're between our 1.5 and 2 years. And for this year, 2025, we did double the number of mammograms we did compared to last year, compared month over month. So, it's been tremendous in terms of growth. So that's kind of where I'm at right now, Derek.
Well, that's good. I commend you for being 1.5-ish in and having doubled the business, and hopefully into 2026, you can double it again, and then you'll have that ability to scale. The beautiful part is that as an entrepreneur, it's great to grow a business, but you could grow McDonald's, and it's great to grow that from the capital purpose. But if you can grow the Boob Bus and have a second one that's out there, that's not only good for business, that's good for public humanity and the women that are out there. And it's not just the woman, it's her husband and her children, the family, it's everywhere surrounding that. So if you don't grow your business, there's a little bit of disservice. I'm not putting pressure on you, but you want to grow it because the more people you can see and attract, it's better for the economy and healthcare for women as a whole and the family in general too.
Absolutely.
Yeah.
Yes.
Yeah. So I would love for you, if you could, Rena, could you share maybe a success story of somebody that's come through the Boob Bus as a service, and what have they said about it as compared to maybe a previous experience they had?
Yeah. What the first woman that jumps to mind, her name is Jamie, and she would not mind at all me saying her name, but the Boob Bus was invited to do a health fair with one of the big news stations locally. They do an annual health fair. They broadcast it. There are a lot of free services, immunizations, car seat fittings, things like that. And we were there, and Jamie happened to be another vendor at this health fair. And, I kind of walk around and talk to everybody and see what's available. And we were kind of starting to wrap up for the day. The event was nearly over. And Jamie said, "Gosh, what you guys are doing is really neat." She said, "I'm really embarrassed to say, but I haven't had a mammogram in like 5 years." She said, do you think maybe I could come in and get one? And I said, "Yeah, we're wrapping up. If you've got 15 minutes, we've got 15 minutes. Let's do it." So she came in. And she's a really busy single mom. She's running a business. She was there promoting her own business. Probably would not have made the time to do it. I mean, she was going on 5 years having not had one. So if we had not been right there, I don't know if she would have. And we found a very early stage symptom that was concerning, that could have grown into a more aggressive breast cancer for her. And so she got treatment. She got surgery within about 3 weeks of having had the mammogram, and she's doing great. They're following her. They're doing some more frequent screenings rather than waiting a year. Let's do an ultrasound in 3 months or another mammogram in 6 months. But she really attributes this to saving her own life. And she ended up, we partnered, and then we had an event at her company, which is unrelated to breast cancer, but it's health related. Because she was such a believer in this now. What would have happened to my kids and our future had I not walked onto that bus that day when I had 15 minutes. So that one stands out to me a lot.
Yeah, I love it. That's a little bit of synchronicity, being in the right place at the right time and being surrounded by good people. So she was very, very fortunate. For your company, what would you say your vision is for the next 3 to 5 years?
It feels like it's far out there, but I really would love to have a second bus. We do just get, especially in October, right? October is breast cancer awareness. I'm almost booked up for October next year because we've had people calling. It just kind of happens like that. Sometimes we'll get 2 really amazing invitations, but we just can't do both because you can't be in 2 places at one time with the bus. So I think that would be amazing, because we would be able to expand our reach and see more people. So I would love to replicate this, and potentially franchise this in other areas. We know that the reception has been so good, and the model is just something that people really enjoy. So I think that this would be amazing in other places. Another thing that I would mention too, right now we're only able to take care of that initial screening mammogram. There are a lot of challenges to being able to do the additional tests, the diagnostic tests, the biopsies. But I think, in my heart of hearts, I would love to be able to take care of a woman from, the first step through the final step. And that's probably going to have to come with some hospital partnerships and some other things. But, it's a sensitive time for women who have to go through that. And I don't want them to feel like they're a burden and they're being handed off. I would like for us to be able to be involved and have the tools and be regulated to do that through the whole process.
Yeah. Well, that speaks a lot to integrity and ethics, that you want to do what's best for that client, patient of yours. Would it be the best if they could go to a secondary unit to have that if you had it, or however that would work for you? I'm sure they would rather be around your company, your employees, the atmosphere that's there to have that. But, in time it will come. You've got the vision for it. You keep going after it, it'll
Yeah.
probably happen. So I think that's wonderful.
Thank you.
Wherever people are watching this or listening to this, Rena, if they want to learn more about the Boob Bus, and if they're in the Intermountain West region, how can they learn about it? And if anybody, like even here in Idaho, if somebody's interested, where would you like to send them to learn more?
I probably our website, www.theboobbus.com, pretty straightforward. And then we're also on Facebook, Instagram, and LinkedIn. So it would be great to have more followers, especially if we do get to break into a new region. Hey, women of Idaho, we'd love to see you. We're going to be in Twin Falls this weekend, or Boise that weekend. So that would be great. I'd love it if people followed. We'd like to do fun tips and statistics, and just really engage people and make sure that breast health is top of mind.
Okay. Love that. So I will share all of your links. It'll be in the descriptions, whether it's in the podcast itself or some of the shorts that we send out. So we want to make sure everybody has that information. 2 last questions here, Rena, as we go to wrap up. I know you're dealing with women and breast health, and maybe your answer will be associated with that. But if you could give one tip to improve individuals' health, what would you say that should be?
Oof, man. Yeah, that's a good one. I'm a genetic counselor by training, so I really cannot get away from, the family history component, and some people don't know. Actually, November is a prime time, Thanksgiving coming up, getting to be around family members. I think being aware of the health challenges that exist in your family that you may be genetically inclined towards is a really, really good thing. Of course, we have a very large percentage of our community, friends, colleagues, listeners that are adopted, and they may not know that for them. So there are some really good genetic screens out there to be able to know, am I at a high risk for breast cancer, ovarian cancer, some sort of heart disease. So there are a lot of great genetic testing laboratories out there who will do those kinds of family health screens that I think are really worth their weight in gold.
Thank you for sharing that. I think that's important. It's a very unique take. I thought it was going to be, if you're a woman at 40, get a breast exam, and we covered that. So you had another answer for me. I love that, from the familiar.
That's right. I wanted to surprise you.
I appreciate it. That's wonderful. Last question, Rena. You're a guest on the Prime Health podcast. What is your definition of Prime Health?
Man, God, it's interesting you asked that, because I just spent a weekend with some girlfriends, and I think we're all in different stages of our own health journey. And so what I've really come away focusing on lately is everyone is going to be in a different phase of their own physical health, their own mental health. And I think that what works for one person isn't always going to work for someone else. I think we can use our friends and those around us as good motivators and examples. But I think just trying to live your best life, be your best, be as healthy as you can be, and improving that little by little over time. Just what makes you feel good and what makes you happy and keeps you engaged. That's what's most important.
I think that's great. It's to not compare ourselves to others is a very important thing to do, especially when it comes to health. And it's unique, just like no two women's breast exams are probably the same. It's a great perspective for people to look at, that, worry about your health, others around you, but don't compare yourself to the others that are out there. So exactly. I appreciate that answer. It's always great. It's always a new, different answer. So I love asking that question. So Rena, I do want to say thank you very much for being a guest on the Prime Health podcast. It's a very unique story. I love how it's come about. Unfortunately, it's a story that does have to have an analysis. Sometimes there's a negative outcome that comes with it, but I think more than likely you shared with your success story that it was a negative result with a positive outcome. So the sooner you get in and continue to get screened at 40, younger, if you feel as though there's a need for familiar health, you'll be able to tell them that when they reach out to you. But I think that's important, that there's so much more than you're doing than just driving a pink bus from location to location. You're helping people change their lives in a very positive way. So I appreciate you sharing that with us. And I always say this, please, as a viewer, as a listener, if you've heard Rena say something that kind of touched you in a certain way, please share this to at least just one person. Yes, we would love you to share it to more. But if there's one woman that you know, a relative, a friend that you know that, hey, they're in the Utah area, Intermountain West region, or I don't care if they're in New York, if you let them listen to this and the importance of it, maybe they'll reach out to their own doctor and say, hey, it's been 5 years. I need to get in and schedule something. So again, thank you very much for sharing that. And I always say, please, we'd love it if you'd subscribe to our podcast. But as I say, so until next time, remember that true wellness is a journey we are all on together. Whether you are taking charge of your own health or helping others in theirs, I always ask if you would stay committed to your Prime Health journey. Again, Rena, thank you very much for being a guest on the Prime Health Podcast.
Thanks, Derek.